I am Lieutenant Colonel Joseph Sanganoo, and I am the full-time staff OIC for the 1st Armored Brigade Combat Team headquartered in Rosemont, Minnesota. I'm also concurrently assigned as the Battalion Commander for 2-136 Infantry Cab headquartered in Moorhead, Minnesota. Over my career, and in fact even before I became full-time with the military, I actually worked as a county health social worker. As part of my casework there, I actually worked with individuals, who had difficulty with substance abuse, families, teens, high school kids that struggle with substance abuse. So I've seen it across many different generations and age groups and different things. And so that has provided me with some insight, if you will, in terms of treatment modalities or how you provide resources to people that may be struggling with substance abuse. Going back to having worked as a county health social worker, I was also a second lieutenant. I had just been second lieutenant at the time too, back in 2002. And so, I was starting to see some of those same type of behaviors in some of the soldiers that were within my platoon and company. And so I would share some thoughts and ideas with people, not by any means, not from any command position, but an opportunity to share what I know. And, sometimes life happens. And interestingly, within my own family, during and after the first deployment, and has basically persisted ever since. Through that time frame, I went through what I would say the grieving process, if you will, to really watch somebody that you love and not quite understand how they could get addicted, and certainly I wouldn't say necessarily destroy, but really alter the course of their life through substance abuse. And so I had to do an internal look, if you will. One, as a leader within the Minnesota Army National Guard, leader of soldiers, the best assets that the Army has. And truthfully, it came down to me of how do I honor my truth? How do I get my soldiers to come to me and talk to me about, the trials and struggles that they're experiencing on their everyday life if I am not transparent with them in terms of what I'm also experiencing? Over time, I utilized that platform to really engage soldiers and really share my experiences in terms of the struggles that I had. And believe me when I say that I had it wrong. I got it wrong multiple times, hundreds of times, in terms of what I thought substance abuse was, what it is, what it isn't, and that people can just quit if they want to, and what's the matter with people. But then through that, I also became enlightened from the standpoint of, okay, this is bigger than me. I cannot solve it on my own. I need to reach out to others that are the experts, others that knows better, others that have maybe experienced this in the past. And so through talking with my commanders at the time, who have been very supportive, I decided to go to counseling myself, because as a husband, as a dad, a leader, and all the requirements that I had to fulfill on a day-to-day basis, it was actually changing who I was. During that time frame, I was very agitated, quick to, I wouldn't say necessarily anger, but just things would get under my skin very quickly because of the stress that I was going through at home, and I just didn't quite know how to deal with it. And so I decided to go to counseling, one, to understand what substance abuse really is. Sure, I mean, in layman's terms, anybody can say, well, it's addiction, but really, what is it? And how do you help somebody that is struggling? And what are the actions on my part that may be helping or possibly even enabling their actions? And so through counseling, I guess over time I've equated counseling with doing what I call a deliberate risk management, because it's about it's about a continuous awareness of the risks, right, and the hazards and the stressors that we're going through in life, and how do we deal with them. And those are the controls, right? What are the controls that we're putting in place to help us cope and help us keep moving forward on a day-to-day basis. And so through counseling, I gained that self-awareness of my triggers, not being somebody who's chemically dependent, but of what would trigger me in terms of making me angry, and what would make me more stressed, and maybe not allow me to be as focused and concentrate on the work that I was doing, or even being a parent. Secondly, it helped me understand what chemical dependency or substance abuse was from the standpoint of somebody that's struggling with it. And that knowing that it's not something that somebody can just arbitrarily just say, hey, I'm done. Maybe some people are successful that way. I've heard people have quit cold turkey. But I think the mantra that, is synonymous with Al-Anon and all of the AA, Alcoholics Anonymous type meetings, is one day at a time. And I will tell you that I struggle, even to this day I struggle with it, because I'm always planning things weeks, months, years ahead of time. And to internalize the one day at a time, that is still an ongoing battle for me. But then when I put it into perspective, I understand why people that are struggling with substance abuse need to take that approach. At the end of the day, regardless of the rank that we wear, we're all human. We all experience the same things in life. Maybe we're married, maybe we're single, maybe we have children. We all have families, and we all have struggles. And I want to bring in the human aspect of this. And when we talk about our soldiers being our greatest asset, if that is the truth, then we need to honor our truth as leaders and be vulnerable with our soldiers and set the example and show them that we also have struggles. But we also go out and we seek assistance, and we go to counseling, and we do all of those things to basically, what I say is recalibration of our thinking process. Okay? And so I think if we can demonstrate that we at some point in our life need to lean on each other, lean on our battle buddies and our friends, families for help. Our soldiers, we would be more inclined to follow suit at that point. And more importantly, you would earn their trust, because they have a real human talking to them, and not just a name behind a uniform that they do not know. From my experience, what I can tell you, and again, not being the subject matter expert, but I know that there is a significant correlation between personnel that struggle with substance abuse and mental health. Okay? And oftentimes, and if you take a look around at the treatment modalities that currently exist, whether it be within the Minnesota Army National Guard or within this civilian public structure, you will find more oftentimes than not that people with substance abuse, they will go through the substance abuse evaluation, and they'll be recommended to go to counseling, or go to Al-Anon or different things like that. But the number of times you're able to go to counseling and the depth of the counseling that they're receiving may not be necessarily addressing the mental health problem. That's more of like an antecedent, if you will, or a precursor to the substance abuse that they're experiencing. So what I find is, especially for soldiers that go to inpatient treatment, they're more likely to be successful or remain sober or remain chemical free if they go through treatment centers that are what I call dual MICD treatment centers that treats them equally at the same time for mental health, for mental illness, at the same time as chemical dependency. It's kind of like, which one do you treat first, right? But I think if you treat them concurrently, I think you stand a better chance of allowing that soldier to remain sober and chemical free. Whoever told you that seeking help or counseling will tarnish your reputation or inhibit you from progressing in the ranks do not know what they're talking about, and they're absolutely incorrect. As I just told you at the beginning of this interview, I, as a young lieutenant, was going through this with my very own family member. And here I am sitting today as a lieutenant colonel in the Minnesota Army National Guard, not on my own, volition, but because of the leaders that supported me along the way. Leaders that would sit and listen to me and encourage me along the way. And they made some accommodations for me, whether it be with my full-time assignments, so that I could stabilize my family and receive the help that I needed, the help that my family needed, And so, I am very proud of all of those accomplishments, and I'm very proud of sitting where I am today as the 1st Armored Brigade Combat Team, full-time staff OIC, the largest brigade in Minnesota Army National Guard, while also being given the opportunity to command a combined arms battalion. Being a commander of soldiers is the greatest thing that I can ever hope for within the military. And so I can look any soldier in the eye and tell them, no, the right thing you need to do is to seek out help, go to counseling. Yes, by definitely means if you're struggling with chemical abuse or substance abuse, seek the help that you need. And the Minnesota Army National Guard will be right there alongside you, cheering you along and being there for you when sometimes people do slip up, okay? And sometimes those things happen. But understand that we're human beings and that the Minnesota National Guard understands that. Last thing I would say, is this. If there is any soldier or their family member that is struggling with substance abuse of any kind, I am easy to reach. I would be very happy to sit down with them and have a one-on-one conversation over coffee, lunch, dinner, and talk about this. Because I know for a fact that within my battalion, without my soldiers, I'm just another colonel, right? But with my soldiers, I make a cohesive team. And so I need them to seek the help that they need so that we can build a cohesive team that we need to, and when necessary, fight and win our nation's wars.